What if I told you that some of the medications you take every day to feel better might actually be putting your heart at serious risk? I'm Dr. Lucas Mason, and today we need to talk about something that affects millions of older adults, something that's hiding in plain sight in medicine cabinets across the country. You see, there's a growing body of medical evidence that's deeply concerning. Medications that doctors prescribe routinely, drugs that seem harmless, drugs you might have been taking for years, could be silently damaging your cardiovascular system. And the frightening part? Most people have no idea this is happening until it's too late. Let me share something with you. I've been practicing medicine for over 20 years, and I've seen this pattern repeat itself again and again. Patients come in feeling great about managing their acid reflux, or their insomnia, or their chronic pain. They're following doctor's orders, taking their pills exactly as prescribed, but then, seemingly out of nowhere, they start experiencing heart palpitations, or chest discomfort, or worse, they end up in the emergency room with a cardiac event that nobody saw coming. The truth is, we're living through a hidden epidemic. The very medications designed to improve quality of life in our later years might be stealing years from our lives by attacking the one organ we absolutely cannot live without: our heart. Now, I want you to think about this for a moment. How many prescription bottles do you have in your home right now? 2, 5, maybe more? If you're over 60, statistics tell us you're probably taking at least 4 different medications regularly. That's normal in modern medicine. We have pills for everything. But here's what's not normal. Very few people, including many healthcare providers, fully understand how these drugs interact with an aging cardiovascular system. Let's start with something incredibly common: proton pump inhibitors. These are the medications millions take for acid reflux and heartburn. You might know them as omeprazole, lansoprazole, esomeprazole. They're sold over the counter now, which makes them seem completely safe, right? You can just walk into any pharmacy and buy them without even talking to anyone. But here's what the research is now showing us, and this is absolutely critical. Long-term use of these acid reflux medications is associated with a significantly increased risk of heart attack and cardiovascular death. We're not talking about a small increase. Some studies suggest the risk goes up by 20 to 30% or even more with prolonged use. Why? How does a drug for your stomach affect your heart? It comes down to something called endothelial function. The endothelium is the delicate lining of your blood vessels. When proton pump inhibitors suppress acid production so dramatically, they also interfere with the production of nitric oxide, a crucial molecule that keeps your blood vessels relaxed and healthy. Without adequate nitric oxide, your blood vessels become stiff and narrow. Blood pressure rises. Clots form more easily. The stage is set for a heart attack. And here's the thing that keeps me up at night. Millions of people are taking these medications not because they have severe reflux disease, but because they have occasional heartburn. They started taking them years ago, maybe after seeing a commercial on television, and they just never stopped. Nobody told them this was supposed to be a short-term solution. Nobody warned them about the cardiovascular consequences of taking them for 5, 10, 15 years. Let me tell you about Margaret. She's 73 years old, vibrant, active in her community. She came to see me about 6 months ago, complaining of unusual fatigue and occasional chest tightness. When I reviewed her medications, there it was. She'd been taking omeprazole twice a day for over a decade. Her previous doctor had prescribed it, and she just kept refilling it, assuming it was fine because she could buy it at the drugstore without a prescription. When we ran tests, Margaret's endothelial function was significantly impaired. Her cardiovascular risk score had climbed into the danger zone. We worked together to gradually reduce and then eliminate the proton pump inhibitor, addressing her reflux through dietary changes, sleeping with her head elevated, and using safer alternatives only when absolutely necessary. Within 3 months, her symptoms improved. Her cardiovascular markers began to normalize. She got her energy back. Margaret was fortunate. We caught it in time. But how many people like her are out there right now, unaware that their heartburn medication is slowly compromising their heart? Now let's talk about antibiotics, specifically a class called fluoroquinolones. These include ciprofloxacin and levofloxacin. They're powerful antibiotics, often prescribed for urinary tract infections, respiratory infections, and various other bacterial problems. They're effective, they work quickly, but they come with a dark side that's only recently become clear. The FDA has issued multiple warnings about fluoroquinolones because of their association with aortic aneurysm and aortic dissection. Let me explain what that means in plain English. These medications can weaken the wall of your aorta, the main artery carrying blood from your heart to the rest of your body. When the aortic wall weakens, it can bulge like a balloon, forming an aneurysm, or it can tear, causing a dissection. Both situations are life-threatening emergencies. The risk is particularly high in older adults. If you're over 60, if you have high blood pressure, if you have any existing cardiovascular disease, taking a fluoroquinolone is like playing Russian roulette with your aorta. And yet, these antibiotics continue to be prescribed routinely, often for infections that could be treated with safer alternatives. Beyond the aortic risk, fluoroquinolones are also associated with heart rhythm disturbances, specifically a dangerous condition called QT prolongation. This is where the electrical signals in your heart take too long to reset between beats. It creates a window of vulnerability where a fatal arrhythmia can suddenly develop. You might feel perfectly fine one moment, and the next, your heart is in a chaotic rhythm that can't sustain life. I've had patients tell me, "But doctor, I've taken these antibiotics before and nothing bad happened." And that's the insidious nature of cardiovascular risk. It's cumulative. It's probabilistic. Just because you got away with it once or twice doesn't mean you'll be fine the next time. Each exposure increases the risk. Each time you roll the dice, the odds get a little worse. Then we have NSAIDs, non-steroidal anti-inflammatory drugs, ibuprofen, naproxen, diclofenac, celecoxib. If you have arthritis, back pain, or any chronic musculoskeletal condition, you've almost certainly taken these. Many older adults pop them daily like vitamins, not realizing they're taking a significant cardiovascular gamble. The data is absolutely clear. Regular use of NSAIDs increases the risk of heart attack and stroke. Some NSAIDs are worse than others. Diclofenac appears particularly dangerous, but none of them are truly safe for long-term use, especially in people who already have cardiovascular risk factors. These drugs work by blocking enzymes called COX-1 and COX-2, which are involved in inflammation. But those same enzymes also help protect your cardiovascular system. When you block them, you interfere with processes that prevent blood clots, regulate blood pressure, and maintain healthy blood flow. The effect isn't subtle. Studies show that taking NSAIDs can increase heart attack risk by 30 to 50% in some populations. If you're already at elevated risk because of age, diabetes, high blood pressure, or previous heart disease, adding an NSAID to the mix is like throwing gasoline on smoldering embers. What makes this particularly tragic is that many people are taking NSAIDs not because they work particularly well, but because they don't know what else to do. The pain is real. The arthritis is real. They need relief, but nobody has sat down with them to explain that there are other options: physical therapy, targeted exercises, weight management, topical treatments, alternative pain management strategies. Instead, they get a bottle of pills and a vague instruction to take them as needed. Robert is 68. He's been taking ibuprofen 3 times a day for 5 years to manage knee pain from old sports injuries. When he developed chest pain and ended up in the emergency room, the cardiologist found significant coronary artery disease. Was it entirely caused by the ibuprofen? We can't say for certain, but we know the ibuprofen didn't help. We know it increased his risk. We know that if someone had intervened earlier and helped him find safer pain management approaches, he might not be facing bypass surgery right now. Let's shift to diabetes medications. Now, most diabetes drugs are relatively safe for the heart. Some, like certain SGLT2 inhibitors and GLP-1 agonists, actually protect the heart. But there are older medications still in use that carry cardiovascular concerns. And here's a broader issue that doesn't get talked about enough. The intense focus on lowering blood sugar numbers can sometimes lead to excessive medication use, which brings its own risks. Some older sulfonylureas, medications that force the pancreas to produce more insulin, have been associated with increased cardiovascular events in some studies. The mechanisms are complex, but they involve effects on potassium channels in the heart and potential impacts on the heart's ability to protect itself during periods of stress or reduced blood flow. More concerning is the risk of hypoglycemia, dangerously low blood sugar, which can occur when diabetes medications are dosed too aggressively. In older adults, hypoglycemic episodes significantly increase the risk of heart attack, arrhythmia, and sudden cardiac death. Your heart needs a steady supply of glucose to function. When blood sugar drops too low, especially during sleep when you're not aware of the symptoms, your heart is placed under extreme stress. I've seen patients who were so focused on getting their A1C numbers down, their long-term blood sugar marker, that they were experiencing multiple episodes of low blood sugar each week. Their doctors kept adding medications or increasing doses, chasing an arbitrary target number, not recognizing that the treatment itself was becoming more dangerous than moderately elevated blood sugar. The key principle here is individualization. What's the right blood sugar target for an active, healthy 70-year-old with no other health issues? That's different from the right target for an 85-year-old with multiple medical problems. But too often, everyone gets treated the same way, following rigid protocols that don't account for individual cardiovascular risk. Now let's address something that affects millions: sleeping pills and anxiety medications. Benzodiazepines like diazepam, lorazepam, and temazepam, newer sleep medications like zolpidem. These drugs are prescribed incredibly freely, especially to older adults who struggle with insomnia or anxiety. They seem to work. You take the pill, you fall asleep. What's the problem? The problem is that these medications significantly increase the risk of falls, confusion, and respiratory depression, especially when combined with other drugs. But beyond those immediate concerns, there's emerging evidence linking long-term use of benzodiazepines with increased cardiovascular mortality. The mechanisms likely involve effects on breathing during sleep, impacts on blood pressure regulation, and increased systemic inflammation. Additionally, these medications can mask symptoms of underlying conditions that affect the heart. If you're feeling anxious or can't sleep, that might not be a standalone psychiatric issue. It could be a sign of heart failure, of coronary artery disease, of arrhythmia. By medicating the symptom without investigating the cause, we might be missing critical cardiovascular problems until they become emergencies. I had a patient, Dorothy, who was 76. She'd been taking a benzodiazepine for sleep for 12 years. She came in feeling increasingly tired during the day, anxious, not herself. Everyone assumed it was depression or just aging. But when we carefully weaned her off the benzodiazepine and ran proper tests, we discovered she had atrial fibrillation that had been present for years. The medication had been masking her symptoms, the palpitations and sleep disturbance that might have led to earlier diagnosis. By the time we found it, she'd already had a small stroke. Antipsychotic medications represent another major concern, especially when used off-label in older adults for agitation, confusion, or sleep problems. Drugs like quetiapine, risperidone, and haloperidol carry black box warnings about increased mortality in elderly patients with dementia. Much of this increased risk comes from cardiovascular effects. These medications can cause severe drops in blood pressure when standing, dangerous heart rhythm abnormalities, and increased blood clotting. Even when used for legitimate psychiatric conditions, antipsychotics require careful cardiovascular monitoring. They affect the electrical conduction system of the heart. They can prolong the QT interval we talked about earlier, setting the stage for sudden cardiac death. They alter metabolism in ways that promote weight gain, diabetes, and cholesterol problems, all of which increase cardiovascular risk over time. The tragedy is that these powerful medications are sometimes prescribed casually, as chemical restraints for difficult behavior in nursing homes or as quick fixes for insomnia, without proper consideration of safer alternatives or thorough evaluation of risks versus benefits. Opioid pain medications are another category we must discuss. While opioids themselves have complex cardiovascular effects, including potential impacts on heart rate and rhythm, the bigger picture involves how chronic opioid use affects overall health and cardiovascular risk. Chronic opioid therapy is associated with increased rates of heart attacks, particularly in the first month of use or when doses are escalated. The mechanisms are multifaceted. Opioids can cause hormonal changes that affect cardiovascular health. They reduce physical activity and exercise tolerance. They contribute to sleep-disordered breathing, which stresses the heart, and they're often combined with other medications that have their own cardiovascular effects, creating dangerous drug interactions. Furthermore, the whole issue of pain management in older adults needs rethinking. We've gone from undertreating pain to potentially overtreating it with medications that carry serious risks. The answer isn't to let people suffer, but to develop comprehensive pain management strategies that emphasize safer approaches. Physical therapy, interventional procedures, psychological support, and judicious use of medications that carry lower cardiovascular risk. Here's what I want you to understand. I'm not saying all medications are bad. I'm not suggesting you should stop taking prescribed medications without medical guidance. What I am saying is that awareness is power. Knowledge is protection. You have the right and the responsibility to understand what you're putting in your body and what effects it might be having on your heart. Every medication is a trade-off. Benefits versus risks. For some people, in some situations, these medications we've discussed are absolutely necessary and the benefits clearly outweigh the risks. But for many others, safer alternatives exist. Non-drug approaches work. Lower doses might be sufficient. Different medications in the same class might carry less cardiovascular risk. The problem is that once you start a medication, there's tremendous inertia. You keep taking it. Your doctor keeps prescribing it. Nobody really reassesses whether you still need it, whether the dose is appropriate, whether the benefits still justify the risks. This is especially true for medications that were started years ago, sometimes by doctors you no longer even see. So what should you do? First, make a complete list of every medication you take, including over-the-counter drugs and supplements. Write down why you started each one and when. Then schedule a comprehensive medication review with your doctor or a clinical pharmacist. This isn't a regular checkup. This is a dedicated appointment focused entirely on your medications. Ask specific questions. Do I still need this medication? What would happen if we tried stopping it or lowering the dose? Are there safer alternatives? What are the cardiovascular risks of this drug specifically for someone my age with my health conditions? How does this medication interact with my other drugs? Don't be afraid to advocate for yourself. If your doctor seems dismissive or too busy, find a healthcare provider who will take the time. Your heart is worth it. Your life is worth it. Consider seeking out a geriatric medicine specialist or a cardiologist with expertise in medication management in older adults. These specialists understand the unique vulnerabilities of the aging cardiovascular system. They know which medications to be especially cautious with. They're skilled at finding that balance between managing symptoms and minimizing harm. For acid reflux, explore lifestyle modifications first. Smaller meals, avoiding trigger foods, not lying down immediately after eating, elevating the head of your bed. If you need medication, consider safer alternatives like antacids or H2 blockers for occasional use rather than daily proton pump inhibitors. For pain, investigate physical therapy, acupuncture, topical treatments, gentle exercise programs designed for your specific condition. If you need oral medication, acetaminophen at appropriate doses is generally safer for the heart than NSAIDs, though it has other risks that need monitoring. For sleep, address underlying causes, sleep apnea screening, cognitive behavioral therapy for insomnia, sleep hygiene education, treating restless leg syndrome or other specific sleep disorders. Medications should be a last resort, not the first line of treatment. For infections, ask your doctor if a fluoroquinolone is truly necessary or if there are safer antibiotic options available. Often, there are. The point is this: we have options, we have choices. Modern medicine offers many paths to managing health conditions, and the medication route, while sometimes necessary, should be chosen thoughtfully, not reflexively. I also want to emphasize the importance of regular cardiovascular monitoring if you are taking any of these higher-risk medications long-term. That means periodic EKGs to check your heart rhythm, blood pressure monitoring, lipid panels, sometimes more specialized testing depending on your specific situation. Early detection of cardiovascular changes allows for intervention before serious damage occurs. Your heart is remarkably resilient, but it's not invincible. Years of medication exposure can take a toll that sneaks up gradually. You might not feel it happening. You might feel fine right up until the moment something goes very wrong. That's why prevention and vigilance matter so much. I want you to feel empowered, not frightened. Yes, there are real risks we've discussed today, but there's also real hope. By being informed, by having honest conversations with your healthcare team, by being willing to explore alternatives and make changes, you can significantly reduce your cardiovascular risk. Think of your medications not as permanent fixtures in your life, but as tools that should be regularly evaluated and adjusted. Your health status changes, your needs change, your medication regimen should change accordingly. And remember, you're not alone in this. Millions of older adults are navigating these same questions and concerns. Healthcare is increasingly recognizing the importance of deprescribing, the thoughtful process of reducing or stopping medications that may no longer be beneficial or may be causing harm. This is becoming a standard part of good geriatric care. Your heart has been beating faithfully for 6, 7, 8 decades or more. It's carried you through every moment of your life. It deserves protection. It deserves respect. And it deserves a healthcare approach that carefully considers how every medication, every intervention, affects its ability to keep you alive and thriving. So take action. Review your medications. Ask questions. Explore alternatives. Don't wait for a cardiovascular event to make this a priority. The best time to protect your heart is right now, today, before damage accumulates and becomes irreversible. Thank you for watching. Thank you for caring enough about your health to seek out this information. If this video has opened your eyes to medication risks you weren't aware of, please share it with others who might benefit. Leave a comment below about your experiences with medication reviews or concerns about heart health. And most importantly, take what you've learned here and put it into action. Your heart is counting on you. Don't let hidden medication risks steal the years you have left to live fully and well.